Hi class, welcome to week 4. You have a paper due this week. And your paper, there's 7 journal articles to read this week. There's no chapter reading from your textbook, so I know that the articles are in lieu of that reading. There's reading in your DSM. But you're basically going to be writing a paper, a 3-page essay. It doesn't need to be longer than 3 pages. Remember APA formatting. Remember the proper font requirements. And it's for you to explore and explain the symptoms of HIV/AIDS, as well as describe effective treatments. The end of the essay will conclude with a reflection section and a faith perspective. I always recommend, because when I'm grading, it's broken into a rubric, which you are able to see the rubric in week 4 learning activities. When there's a rubric, I would follow that. This is just something for you to know as long as you're in this program. The rubric is super helpful as a guide or an outline to see how you should format your paper, and it makes grading like way easier for the professor. Those are the categories we're looking for as far as when we are grading to decide what points you get for those sections. So just take a look at that, see it, write your paper accordingly, and we won't have any sort of issues. So hopefully you are able to find some peer-reviewed articles. You may use some of the ones listed if they apply to what you're writing. I don't have a problem with that per se. It's also good to look up other things. You have access, to the library through Cal Baptist, and probably on the internet too. There's other peer-reviewed articles on HIV/AIDS. But yeah, so that's week 4. HIV/AIDS, ethics, confidentiality. So when a client comes and discloses that they have AIDS or HIV, one, that's a very personal matter, just as anything is, right? But I think one, stigma has gone down a lot with HIV/AIDS because of research and knowledge, and I find knowledge is power. The more we understand, the more we know, the more we can better treat people, better understand susceptibility, especially in regards to sickness. Like even with COVID, the more we understood how it's transmitted and what to do for care for it, kind of lessens hysteria a little bit. Not to say it's still not serious, something to take seriously, but we can prevent a lot by washing our hands. We can prevent a lot potentially by wearing a mask if that's something you choose to do. Prevent a lot by maybe, if you're susceptible, you take into consideration certain precautions. With AIDS, when it first came out, there was a lot of hysteria, a lot of fear, a lot of accusations. It was a gay person's disease, drug addicts, and this is the thing. AIDS is susceptible. It's one of the transmissions is sexually, but that's not the only people who have a homosexual lifestyle are not the only people who get AIDS. Heterosexuals get AIDS. Infants born of a person potentially who had HIV can get AIDS. AIDS at the time was transmitted through blood transfusions because they weren't screening for it. So there was a lot of fear. And when people are scared, they start to act a type of way. And so that made people very fearful of people knowing their diagnosis, needing to go really covert with their diagnosis. And that doesn't feel good when it's something that's very scary and you need support. And so therapy is huge for people that have terminal illness. And with that, AIDS and HIV. Now there's so many more medications and things of that nature to help someone have a very full life with a diagnosis of HIV. There's even places for people, like support groups, specifically for people with HIV/AIDS, very confidential. I think even if you call in, they won't even tell you necessarily all the information of what it's about because they're trying to protect confidentiality. But it's really great because, again, in some of the group settings, there's people who have had the diagnosis for a long time, people who just found out. So there can be some support. There's support about talking about medications they're on, side effects, because as we know, you're on serious medications, even chemo, right? Like it's killing cancer, but it might be killing other parts of your body, which is really hard. And that's something that AIDS patients go through, HIV patients go through. So we obviously can't refuse or deny seeing anyone over a medical condition or, lifestyle or color of skin, religious preference, anything of that nature. So we need to make sure that we are maintaining confidentiality. We aren't revealing anything about their diagnosis to anybody else. They're entitled to their rights of confidentiality. And that's really important. Now we will have a discussion board this week, and it has to do with AIDS and HIV. So you're going to talk about duty to warn and protect in your discussion board. So just be mindful of like looking into that, because there's some, if someone is HIV AIDS positive and they are purposely having unprotected sex with people, knowing that they're going to give them AIDS, that could be a duty to warn, duty to protect situation. Excuse me. So please check out that article, read it. You want to make sure you're aware of what your role is in those situations. Now, you might have people who have HIV AIDS who have partners that are willing to have sex with them, willing to take that risk. Maybe they have protected sex. That's their personal choice. But if someone is blatantly, purposely going out there, I think I've seen a Law and Order SCVU about this, one of the mini seasons ago, doing that, then there is a potential issue, a potential need to protect and to warn, which is part of our limits of confidentiality, right? However, those are very specific things. That's not just because someone has AIDS, we don't need to protect. If someone has a consensual, everyone's very aware of the situation going on, we don't necessarily need to call and do anything. But it's like that blatant disregard for human life is a problem. We actually used to have a discussion board where there was like that kind of situation, and then you had to work through the vignette and figure out what you would do. So anyways, look, good things to think about, look at, be aware of, because we are mandated reporters. We're called to report, and we need to make sure we know what we're supposed to report and what we aren't supposed to report. So again, knowing when to breach confidentiality and when not to is really important in our role as clinician. One for our client, one for our license. And you work too hard in your life and in your career doing all this schooling, getting those 3,000 hours to lose it to a situation. So just making sure that you're taking the appropriate steps is going to be super important. Some people who have been diagnosed with HIV/AIDS, they feel very isolated and alone. So being able to come alongside someone in that process could be really huge. Also, sometimes they get shunned by family, peers, feeling like they can't be around them, they can't touch them. Can be really hard, coming to terms with having a life-threatening illness. There's a lot of grief in that. So there could be a lot of grief work, even though the person could still live a very full life for many, many years. We have great examples of that in our culture, like Magic Johnson. He's been living with HIV for a very, very long time. I know not everybody has the accessibility probably to certain things he has accessibility to, but there's a lot of modern medicine out there that can be helpful in that. It's just that there's a lot to deal with that, right? And so just like anything, when it comes to terminal illness, working through that and trying to navigate like how they're going to live their life, what they're going to do, letting them grieve, have that space to mourn and work through whatever they need to work through so that they can hopefully find purpose and move ahead and look to life to see like what it could be about versus what it's not going to be about. So just great things to think about. Some of you may know people that have HIV and or AIDS in your life. and you know the hardship it's been on them. You know, medications can be really, really hard on our bodies, and especially when they're hard drugs like an HIV or like a chemo, where it's like maybe, you know, suppressing something or killing something off, and as a result of that, there's like really big side effects. And sometimes the side effects are just as hard as the sickness, you know. So I look forward to your responses, what you learned from the articles. I've been enjoying your readings, what you're writing, and you know, as we go through this class, and as you see, our mental health is very much tied into our sexual function. You know, how sex was taught to us as kids, how it was seen and how it was modeled, how it was discussed in our homes by our peers, our own experiences can really shape and curve um, what our own sexual experiences will be like. Sometimes that's in a healthy way, sometimes that's not. And so really trying to understand where your clients are coming from, their experiences, their trauma, how it was discussed. You know, religion plays into that too. There's a lot of shame sometimes. How all that it morphs together to make it have some baggage, you know, and our job is to try to see the baggage and figure out how we can get rid of it, you know. So anyways, I wish you all the best. Week 4, we're halfway done. Almost there, folks. I hope you have a great week.